For Practice Update, I'm Dr. Farzana Hafizullah. Thank you for joining us today. Today I have with me Dr. Howard Sandler, Ronald H. Bloom Family Chair in Cancer Therapeutics and Professor and Chairman of Radiation Oncology at the Samuel Ocean Cancer Institute at Cedars-Sinai Medical Center in LA. Dr. Sandler, thank you for joining me.
Thank you for having me. It's great to be here.
Absolutely. Well, let's start off with talking about radiation therapy and different fractionation schedules. I know you reviewed several different abstracts and there are some new data that came out. Can you share your perspective on best practices related to radiation therapy?
Sure. Just briefly, in prostate cancer, traditional radiation therapy involves daily treatments, 5 days a week, for approximately 8 weeks. It's 40 or maybe 45 sessions. So it's a lengthy, albeit very effective, but lengthy course of treatment. There is some biological rationale to shorten the course of treatment. Radiation oncologists have been interested in this hypofractionation hypothesis for quite a while, and 2 studies presented at the GU Cancer Symposium in 2016 suggest that that hypofractionated or shorter courses of radiation therapy may become standard of care. And I'll just describe them briefly.
Please.
Too. One was a study that was performed in the United Kingdom called the CHIP study. This was a large 3-arm randomized trial comparing conventional radiation with 2 hypofractionated regimens. One was 20 fractions, 20 treatments to a dose of 60 gray, and the other was 19 treatments to a dose of 57 gray. The patients were followed very carefully. Quality of life data was assessed, and all 3 treatments, standard and the shorter ones, seemed to be very well tolerated.
That's great. Your convenience and cost, right? You're saving on cost and it's also convenient for the patient, but you said quality of life as well.
Yes, it's a win-win. There was no harm to the patients by shortening, and certainly they are happier to have their normal schedule back sooner. Importantly, however, there was no adverse cancer control impact as well. So the shorter regimens were not inferior to the longer regimen. And so for many reasons, I think this kind of approach is likely to be adopted. The other trial that was presented was an RTOG study presented by Robert Lee. This was about 1,000 men who were randomized to a standard radiation approach of between 7 and 8 weeks, or a hypofractionated approach of 28 treatments, so a little bit longer than the UK, but still quite a bit shorter than our standard. And this non-inferiority study also strongly confirmed that the shorter treatment was not inferior, was, in other words, just as good as the standard, but several weeks shorter. In the US study, they did detect a very, very slight increase in some side effects, but my view, and I think the view of many, is that this difference was so small that it may not be important enough to, and so the shorter regimen from the US study and the UK studies all could be widely adopted.
So how quickly will this become standard of care?
That's a good question. I think in medicine, sometimes people are slow to adopt new things. I know I can make an analogy with breast cancer, where they've also done hypofractionated studies and also have shown that shorter treatments can be used, but it's despite more than 5 years of follow-up after the breast cancer studies have been released, hypofractionation is still only slowly being adopted. You know, I think people are just cautious about changing things too quickly when they have an effective treatment. You're a little nervous about making changes. So I think we're kind of conservative by nature in terms of changing things. So I think over time there will be adoption, but it's not going to happen overnight.
Absolutely. I completely understand that. In just all areas of medicine, you see that happening. It's the current theme, that slower adoption, just until maybe you get more information, or more results that can prove the theory correctly. But I really appreciate your perspective today. Thank you for sharing your expertise with us. Well, thank you for joining us for Practice Update. I'm Dr. Farzana Hafizullah.